Hello, everyone. So it's your girl Valerie Mason Chase, and
Oh, me?
yeah, you.
My name? Frank.
I'm telling y'all, we've been doing this for a few weeks now, and every week this man
Gotta
come
be
on.
different. I ain't gonna be the same.
No, he come on
I'm
here.
not the same as I was. I ain't gonna be the same every week.
No, he come on here acting like he don't know what his name is. But anyhow, welcome to another episode of Marriage Matters, brought to you by Marriage Beyond the Breach. And today is a very special topic. This is what we're going to talk about. You know, when Frank, when you and I got married, we had kind of traditional wedding vows. And a lot of people have traditional wedding vows, and those traditional vows include the words in sickness and in health. But at the time that those vows are made, very few people even consider the concept of ever having to deal with any type of illness, whether it's a physical illness or mental illness. But what do when illness enters into the marriage relationship? How do you navigate that? What does the couple do? What do they draw on to help them get through that process? So that's what we're going to be talking about today. And we have two y'all see me grinning, right? Two very special guests, my brother friend Danny and his beautiful wife Rachel. So we're going to bring them on right now. There we go. Hey, Danny. Hey, Ray.
Hey.
Hi.
Hello.
How y'all doing this evening?
Fine.
So I want to thank you guys for joining us. Wait, I'm trying to get to my Facebook here on my phone. Thank you guys for joining us. Thank you so much for agreeing to do this.
You're welcome.
Because even when someone has an illness that they're dealing with, it's not always something that you necessarily want to share with the general public. So I appreciate you guys and your willingness to come on and to talk about this. So what? Go ahead, baby.
I was going to say sometimes even in a relationship or a marriage, one or the other spouse might be reluctant or even afraid to share what they're going to their own partner. Fear, worrying about embarrassment, other kinds of things. You might not speak on it.
Yeah. That's true, babe. That is very true. Hey, Liz. Hey, Alma. Thanks for watching. Thanks for tuning in. I appreciate y'all. So what I'd like you guys to do is just introduce yourselves. And I'm going to ask you what I ask all of my couple clients. And that is to tell me a love story. You know, how you met, how you fell in love, what brought you guys together. So talk to me.
Sorry.
First of all, to Valerie and Frank, we want to congratulate you on your marriage ministry, on navigating, helping couples and married couples navigate through this process. And we just want to give you big props to you for doing this.
Thank you.
Big props to you guys.
Thank you.
That's wonderful that y'all guys have this avenue that couples and married couples can go to.
Mm-hmm.
So big props to you guys.
Thank you. I appreciate that. I appreciate that.
Okay, I'm Dan Taylor, and this is my wife.
I'm Rachel.
And our love story. Our love story started out on the job. Like pretty much a lot of people on the job. They meet and they get married. I met Rachel 30 years ago at the VA hospital. And I was singing in the solarium. And she wanted to know who's that guy singing in the solarium. So
he was supposed to be working, and he's in the seat.
I'm a whistle while you work type guy. So she popped that, but we didn't start dating till like years later from that day.
Right.
And about years later, Rachel and I started dating, and as the old folks would say, I called at her for 3 years.
Okay. All right.
And then we got married. It's been like 26 years now.
Yeah. And we got engaged on Thanksgiving at my aunt's house. And I remember it because my brother, he jokes with me saying, "Do you remember when you got engaged with Danny?" You were wearing a red shirt that said Goofy on it. I gave you the indication of what I was getting into. Danny loves to joke, you know.
Oh, that he does.
Oh wow. Danny is a jokester. He absolutely is a jokester. Okay, thank you for sharing that with us. So let me ask you this. Were those words in sickness and in health a part of your wedding vows when you got married?
Yes, it was. But just like Frank was saying, I didn't have a clue what that really meant. I mean, I know what it means, but to really comprehend it and understand it, until you walk in those shoes, you really don't know what you're in for.
Right.
Know? Because, well, to be honest, I came into the marriage already sick with my heart problem. So, but I feel I was a strong woman and I didn't need much support. I could do things and carry my own. But when Danny got sick, that's when I really saw another side, because you always expect your man to be strong and all that. And now when he's no longer able to be strong, and I have to be strong for him in a sense.
Yeah.
That became difficult. And that's when you see your vows take place where, okay, you said in sickness and in health, till death do you part. You got to kick in and do what's expected of you as a wife. And I did.
Yeah. You are. You know what? That's so true, because it's easy to say those vows and even attempt to live out those vows until the actual thing you're faced with.
Right.
Okay, because it's easy to be lovey-dovey and supportive and all that stuff when everything is good, when there's no challenges anywhere. But that's when those challenges come, that's where the rubber meets the road. How you're going to handle it, how you're going to deal with it.
Right.
Yeah.
And Val, like I was saying too,
Danny, when I was saying earlier, when you get married, like in our case, we're in our 20s. Who the heck is thinking about being ill later on? And when I was talking about the embarrassments, when I've gone through some health issues the last few years, I felt less of a man because, I was sick. I wasn't feeling well. I didn't know what was going on. And I didn't want to feel like I was a burden. And sometimes I was suffering silence because I just didn't want to confide in Val and say, hey, listen, I'm not feeling well. This is what's going on. I just keep my mouth closed and hope for the best.
I'm like Frank. I don't do nothing in silence.
We know that, bro. Yeah, we know that.
I need some TLC.
I feel you. So,
oh no, I don't suffer in pain. I want the world to know.
You want everybody to know. Come help me. Come help a brother out, right?
Come help a brother out. But
come help a brother out.
On a serious note, when you sick, the whole dynamic of your marriage changes, because now you done thrust your wife into a caretaker. And that, I would tell anybody, that is a hard job, being a caretaker, and all that lovey-dovey stuff, and now she's doing she literally got to take care of you. I remember there was 2 days I couldn't walk, and Rachel had to wheel me in a wheelchair.
Wow.
Yeah, and it was really hard on her, being now this is my husband, but now you got to do little things for your husband. You may have to put his socks on. You may have to, I see when Frank says, now you like a kid, he got to put his shirt on. I mean, and be, you're a caretaker now, and that's pretty hard.
Yeah. Wow. So, share with us as much as you feel comfortable about the specific health challenge that you guys are facing.
Well, I had I'm it's like what Frank once again says. When he was ashamed, or a long time I wouldn't tell I wouldn't even tell my own father. I think I didn't tell my father for a whole year that I had prostate cancer. I kept it from a lot of people. Only person I told was Rachel and my daughter. And then slowly I started telling other people, but I don't know why you ashamed like you did this.
Like you did something, yeah.
And you didn't do anything. It just came upon you, right? And so then slowly I will start telling people that I had prostate cancer, and then you don't. I think people do it for various reasons why they don't tell, because they don't want that oh, you okay, that kind of like piss you off a little bit when they give you they mean well, but you don't want it.
You don't want people feeling sorry for you.
You
right,
don't.
Right.
You don't want people feeling sorry for you, but it's hard. I mean, I'm saying when you have this illness and it changes you, it's changed your whole. It just changed you, and it's hard. That's all I can say. It's very hard, and you try to keep it. I remember Lee, my daughter said, "But Daddy, can I share this on Facebook? Your journey?" I said, "Oh, you said keep."
Oh, you can say hell no.
I said hell no. And she said, "Well, Dad, this will help people." I said, "I don't want to help nobody right now. I'm trying to help me."
Yes. I get that 100%, because at that moment you have to kind of, the selfish doesn't fit, but that's the only word that I could think of, because you have to focus in on yourself and care for yourself and think about what's going to be in your particular best interest at that time.
Yeah.
So how did you come about getting that diagnosis? What led up to that?
Oh, you gotta.
That's what I really want to hear the brothers. I really want the brothers to hone in on this. I'm going to ask Rachel to speak to that.
Okay. Danny had never been anyone that go all the time for his physicals.
Yeah.
So as a nurse, I would always encourage Danny to go and get himself checked out, do his preventive care and, get screening and all that. And he would finally listen to me, but he'd go and he'd stop. Then he would go back again. And when he went back again, that's when he found out his PSA was elevated.
Okay.
So once it was elevated, then, they made the referral to the urologist, his primary care, referred him to the urologist. The urologist spoke to him and told him he had, he went for further tests. He had to go for a biopsy and MRI and CAT scans and all this to, determine that he did have cancer instead of just an elevated PSA, which could be other things,
Yeah.
But what I want to add to that is I had no symptoms.
Right.
There was no indication.
That's a good thing.
That
no symptoms.
I had prostate cancer. There was no symptom. There was no I had being medically speaking, I had a strong urine. I mean, my urine was strong. The stream, and it was nothing to indicate that there was a blockage or anything. And when the doctor called me, he says, "We have to talk." I said, "No, we don't." He said, "Oh, yeah, we do, Mr. Taylor. We have to talk." I said, "About what?" He said, "You know what?" I got cancer. And he said, "Yeah, you have cancer." And just to hear those words is devastating.
I can only imagine, how scary that would be.
I describe it like, I was like
in shock.
Yeah. And then I called Rachel. Rachel was downstairs, and I said, "Rachel, Ray." And I know she was in like, "What do you want?"
He's always calling me.
I said, "Ray, come here." And she said, "What?" I said, "You gotta come here." And I said, "Ray, I have cancer." And she got that look too. She sat down, and the first thing she said, we're gonna get through this.
Yeah. Great, great, Ray. And I imagine, Danny, hearing those words from your wife may have helped to decrease some of the fears that you were experiencing.
Not at all.
No,
you didn't. Not at all, huh?
When you have the big C, You know, you could fake it that, you know, this is comfort, but you're scared.
Oh,
Because
wow.
you're scared of the unknown.
Yeah.
You know?
Yeah.
But he did lean on me a lot.
I lean on her, but you better believe I lean a lot on Jesus.
And you know what? I just want to say, listen, y'all know I'm a woman of faith. And for me, I have to give honor to God who used Rachel to get you into the doctor's office, because you saying clearly you had no symptoms. No. There was nothing textbook to indicate that there was anything wrong with your prostate.
Right.
So if Rachel had not encouraged you to go get the blood work, the follow-up biopsy, God only knows what would have happened. God only knows.
Right.
But
God knew, so he used Rachel to get that.
Talking medically speaking, it would have gone into like the 3rd stages or the 4th stages of cancer,
which would have been harder
to treat.
Yeah.
That's why early prevention, you know,
early prevention,
care.
Well,
yes.
I was in stage 2, so it was going somewhere it shouldn't be going, but it was in stage 2.
So it was caught early.
It was caught early,
right?
And that gave you additional options in terms of treatment.
Right.
Yes, it did.
Yeah. And are you okay with sharing the option that you chose for your treatment?
Oh no, I'm here to try to help people here, not to be ashamed.
Okay.
You know, I'm trying to help. That's why I'm here tonight, to try to help someone, and I hope we do reach and help someone. Yeah. Well, I had 2 options. I had to remove the prostate altogether,
surgery,
or I could do it through radiation, and I chose radiation.
Okay.
And my sister here, Val, we talked about it. She said if that ever happened to Frank, she want a full removal. But as a man,
I did.
I think you ain't tell me that. No. Go ahead, Daddy. I'm sorry.
But as a man, you know, I have to tell everybody that prostate is very important, and radiation. I mean, you know, I'm still a young man, you know. So I want to keep my prostate, but
because are you okay with saying, because some people don't understand how the prostate functions?
Well, I wanted to keep it because it controls your erection.
Right.
And,
right.
And if you remove it,
you ain't got nan.
You ain't got nan.
unless it's artificial erection.
Yes, you know, absolutely.
Implants.
You get an implant. Right. Yeah.
Daddy looking at you, right?
So you know, that's why I encourage Danny to make the final decision. Because whatever happened, he would have to live with it, and I didn't want him to blame me for whatever happened.
Or resent you. But you know, that is such an important thing for us guys, especially as we get older. You know, we start to freak out if down below don't act like it's supposed to. You know, you started, what's going on? And you feel like your life is over because you can't get an erection, or you don't get as many. Because I go through those thoughts, you know, damn, how come, you know, I'm waking up in the morning, I don't have an erection? Why? Is something wrong? You know, you start to question what the heck is going on. Other than you're just getting a little older.
So, I mean, I understand the decision, how you came to that decision, why you came to that particular decision. But here's the thing. Early detection gave you that option. Had it been later, I don't think that radiation would have even been an option at that point. It would have been surgery, or, you know, if it was truly really advanced.
Right.
But I did say that to Danny. When he was talking to me about radiation, I said, listen, I said, if Frank is diagnosed with prostate cancer, I'm going to tell him, listen, get rid of it. And then as soon as you're healed enough, go get the implant. We'll work with the implant.
You know, I guess the only thing with the implant, you don't have to worry about, you know, getting an erection. Just, what is it? Just squeeze a pump?
Squeeze the pump.
Squeeze it as often as you want, and you do it as many times as you want.
I just want to welcome Cherie, my niece Cherie. And Andrea, welcome, guys. Thank you so much for watching. I appreciate you being here. And you know, we are kind of laughing and joking about it, but you know, that is a serious matter, and I understand how serious it is See, it's easy for me as a woman to say, just get rid of the prostate. Don't worry about the erection. It'll be okay. But looking at it from the man's perspective,
we lose our mind.
Yeah, it's really, really important to a man. I equate that to a woman who has breast cancer and doesn't want to get rid of her breast because that she identifies that as part of her womanhood and femininity, and she doesn't want to get rid of it. So it's kind of the same thing. So I mean, I get that. I absolutely get that. So I want to ask you, health issues can definitely have an impact on a relationship. So how has this impacted your marriage negatively and or positively?
Well, as you know, I'm a nurse, so the impact it had on me was really not as negative as it could have been, because I had knowledge of what was going on with him, and that he needed support, and that I had to be there with him to help him through the different issues that he was going through.
Yeah.
So it didn't affect me in a negative way, and if anything, I would say positive, because we became closer. Because we were doing things that I didn't think I would be doing for my husband. I did for patients, but I didn't do for my husband.
I
was experiencing things with him as if he was a patient of mine. And that made us closer, come closer, as I had to deal with some very personal issues he was going through.
Yeah. And I'm glad you said that, because I think when these types of things happen in a marriage, that it can do like what it did for you guys, bring you closer or pull you further apart. Absolutely. It can make or break the relationship.
Yes.
Now go ahead, Dan.
You know what? Well, another thing too, Val, it showed me I got me a ride or die.
You got a ride or die. You got your people, baby.
I got a ride or die, baby. It's good to know you got a ride or die,
Absolutely. Yeah, because, there are some people who, when their spouse becomes sick, they're gone. They don't want to do this. I didn't sign up for this. I don't want to take care of nobody, and they're gone. Right. I mean, I have had patients who unfortunately have had to deal with that. Their spouse would be completely absent, wouldn't show up to help take care of them. Right. Sometimes when I've had patients in the emergency room, ready for discharge, and they're married with their spouse and nobody to come and pick them up. So it can really happen. It could go one way or the other. And I'm really happy that for you guys, it brought you closer together. And Cherie said, hey, Uncle Danny. Hey, Audrey. Hi. Just shared it, so she's hoping that some more people will join, because she just shared it as well. Babe, did you have something you want to add?
No, I again, just talking about this subject. There's always that fear of, okay, as a man going through cancer issues, not being able to have an erection, it's tough enough him dealing with that. But then if your spouse or your significant other makes it about her, well, how come you don't want, especially in some cases when the man is embarrassed, he's not sharing it. She's liable to think, well, you're not interested in her. And it's all about her. Why you don't want me? And now that becomes a focal point. You're arguing. And like you said, that strain can make them become further apart.
Right. Yeah. I want everybody out there to know it's not completely dead.
Yes, we just want to clarify. Danny Danny opted for the radiation. He did not have the prostatectomy, okay? Now, listen, we got to clarify that, right, bro?
Got to clarify.
Still
working.
Right. Somebody might walk away with, what is it completely dead?
But even if, like we said, even for a man who, where him and his wife do opt to have the prostate removal surgery, there is the option of getting a penile implant. And they are much, matter of fact, at the VA, I had a lot of patients post-operatively who had penile implants, and they're much better and much different than they were years ago.
Right. See, I only know the years ago, so I know how it is.
Yeah, they're much better. They work much better. They don't come back with a lot of complications, and they really do function well. So that is an option, and I'm just hoping that men will be aware of that, because there are some who are in the later stages and don't want to get the prostatectomy because they will lose their ability to have an erection. But listen, choosing erection over your life, I don't know. I'm not a man. I don't know.
See, again, easy for her to say that, but we'll be thinking, listen, I can't get erection.
You don't want to live.
Put the dirt on me.
That sounds like Danny.
I even say, like, well, I go on vacation.
Right. Permanently.
Like, no, really. But all jokes aside, that it affects everyone. But if you have a good wife and she's understanding and she's there and she makes you feel like, hey baby, we're gonna get through this, we're gonna be okay, it helps. It helps.
And I'm just to piggyback onto that, sometimes the quote unquote well spouse kind of gets overlooked in this process. So I want to ask, what is being done to ensure that you, Rachel, as the well spouse, that you are getting the support that you need and that your needs are being met?
Well, you know what? I'm going to be honest with you. This is one question Danny and I was arguing about. He was saying, Rachel, you're answering it wrong. Because I said, I look to God. That's all I needed. I needed the support from God. I need to pray to God, because you can't always go to a family member and discuss personal things. So the only one you could go is to God and pray to him and ask him for direction to, just help you deal with what's going on. Because Danny also, along with being sick, he has a strong personality. He will drive you crazy. So I had to pray to God. I couldn't go to my family and say, he's driving me crazy, I had to and that's what I needed. I didn't need a spa day. I didn't need a girls' night out. I didn't need whatever. That's all I needed was to pray. He didn't think
and I would say that's not what Val asked. Val is saying, what support do you get? Like, everybody always gravitate to the sick person, but who gravitating to you? She going like your family, your clergyman, your neighbor. That's what she was looking for.
Well, the neighbors didn't get involved. The clergy people, they didn't get involved. And plus, we're in a pandemic. Where could you go during a pandemic to get support? Honestly, even if I could have went out with the girls, where am I going?
Where were you going?
I'm scared to go to certain places, But
that's
family, yes. I can call up my brothers and sisters and share with them what was going on, but you can only share but so much, and then you didn't want to get into our personal things. But these are things that happen. I know Danny don't want me to share that. I gotta keep to myself.
You better believe
Take it to the grave.
Get crazy, you want to help y'all, but you're okay.
Treat it like Vegas, right? Treat it like Vegas. Yeah. Right. I get what you're saying. I just want to. My niece Cherie said that's why communication is key. When you're going through something like this, you really should. The spouses need to communicate and talk to one another. And that's very interesting, Ray, because I was going to ask for both of you, as being born again believers, what part did your faith play in getting you through this process?
Well, being a faith believer, what helped me was when I got cancer, and being in church, being involved in church, and being saved. I never once, Valerie or Frank, had that, or why me? Why not me? I know being in church, it was why not me? It happened to the just and the unjust. And I never ever had one pity party, not one. I've never gone through the pity party because God got my back. And I know he had my back. I know God was there. And we sang that song, It's Well With My Soul. It was well with my soul. And it's so true. It was well. I said, God, you got me. And whatever you say, I have to go with it. I'm glad you found favor in me.
Yes. And I think, Ray, you already kind of indicated how your faith has helped get you through this process. It sounds like you leaned a lot on God for support and for encouragement and to have sense of peace to get you through this process. Because I can imagine it's not easy.
It's not, because, as a nurse, you deal with patients, but you go home. This was at home 24/7. You had to deal with it all the time. And there were some difficult times, and with different personalities, you deal with different issues.
So, and like you said, when you're there, it's 24/7. You're there with it all the time, and knowing the strong personality that your husband has, I'm wondering if there were times when you kind of did clash, and if so, how did you handle that?
You know what? When I had a problem with Danny, I had to talk to Danny. I had to share with him, I guess what I was feeling. But I didn't really, I don't know. I was just always there strong for him. It's just that it didn't.
I didn't give her that much trouble, Val. She said, I really didn't. Come on now.
Okay. Your perspective.
He can be a big baby.
I'm a big baby. I need love. I need hold me, touch me. I am so needy. Like, when you say rub my head, will you just rub my head? And I just need touch.
Yeah. So that obviously is one of your main love languages.
My love language is touch. I don't need soup. Touch me.
And it sounds as if you are blessed to be married to a woman who speaks that love language for you and meets that need for you and is there to support you through that. It sounds like that's a blessing, because not everybody has that. Not everybody has that, and whether they're sick or well. So well people don't even have a spouse.
I can honestly say I could burn. I really, in that sense, I could burn Rachel out because I'm needy in that sense, and it's like, here he go again. Like, didn't I just touch? Like, touch again. So I am a needy person. I know that about myself. And I am a big baby when I get sick, and it could burn somebody out. It's like, whoa, this dude is really burning me out, you know. Yeah. But and she gave it to me when she could give it to me. But I know it's a chore. Sometimes it could be a pleasure, but then it can become a chore and a burden.
Yeah. I think that aspect of feeling like a burden may come into play depending on the attitude of the ill person.
Yeah.
If there's this sense of, if they're ungrateful and if they're ornery and ratchety, then it may feel more like a burden. But if they are pleasant and if they show gratitude and they say thank you and please and I really appreciate this, I think it might tend to feel less like a burden.
You're right.
Right.
And it sounds like, Ray, as long as you rub the boy head, he good.
Right. Thank you, Mom.
But when you're initially diagnosed with any kind of illness, the person who's sick might not be able to be anything else but ornery and crotchery and hard to get along with. And that's when the caretaker, the wife or whatever, really has to buckle down and realize, hey, you know what? It's the illness. It's the illness. We need to just get past this, and he or she will be a lot better.
Right. Yeah, I think that is a really, really great point. Because Rachel, as healthcare professionals, we do it at work all the time. We have patients, I've been spit on. Yes. I've had pee thrown at me. I've had poop thrown at me. I've been chased with an IV pole, all that. And we are taught to separate the action from the individual.
Right.
So if we can do it professionally, we certainly should be able to do it personally with our spouse more so.
But you heard the opposite word in there. Should be able to do it with their spouse.
Yeah, because we're human.
You're right.
Because we're human. Okay.
On another note, I have those conversations with Val sometimes when she deals with her clients. I said, Val, you're a professional. You deal with them a certain way, but you don't deal with me the same way. And what does she say? Because you're my husband, I don't have to.
Hello. not all the time. Not all the time, because sometimes it calls for removing those kid gloves, and you just got to keep it real and say, listen, we got to have a come to Jesus conversation right about here. Right. Okay. I may not be able to do that with my clients, although with my close clients, I still do that sometimes, but with your spouse, sometimes you have to take off those kids gloves and say, listen, you being mean, you're being ungrateful, and I'm trying to do everything that I can for you, and you're acting like I'm your enemy as opposed to us being partners. So you may have to have that conversation. Go ahead, Frank. You got something to say?
No, I was just saying again. I kind of disagree with that. I think what you're saying needs to be put on the shelf and wait, because again, the person's dealing with an illness that has him or her just completely zoned out.
Yeah,
and they don't even recognize they being an asshole.
Well, that's why I'm here to remind you how big of an asshole you was being. Okay. But in a sense, I agree with you, and I think there's a time for that, especially in the very acute phase.
Right.
But if it's going to be something that's chronic, and this is ongoing and ongoing and ongoing, there has to be some consideration given to the wear and tear on the emotions of the caregiver.
I agree.
Right.
So what do you have to say about that, Ray?
I definitely agree with that, because knowing what changes that Danny was going through, I had to allow him time to go through it. But yes, you went through stuff, Danny, but I couldn't allow him to stay stuck, because you can get stuck. And you keep acting like you a baby. You keep acting like you can't do this. I'm going to share one little personal thing. Was that urinal. Oh! That urinal drove me crazy. Whoa. In the beginning stages, use it. But then when it get to, you're getting a little better, don't just use it like it's a potty in the room. You get up and you do what you have to do. So sometimes you have to be firm with them. You can't let them walk over you, because, I know you're going through stuff. I'm supposed to feel sorry for you. Yes. But as you improve, your behavior should improve.
Okay.
Go to the bathroom.
We can agree on that. Absolutely.
Yeah, because like you said, otherwise they'll get stuck and there'll be helplessness. Yes. They'll get this sense of helplessness and feel like there are things that they can't do when in actuality they are physically capable of doing them.
Right.
But if you continue to enable that particular behavior, they can definitely get stuck there and they won't move on, and it'll seem like there's no improvement.
And just kind of sticking with that for a minute, at least for me as a man, when I've had certain issues or surgeries, I wanted to rush my recovery. I'm a man. I'm okay. No, it might have been post-op surgery, maybe not even 3 days, and I'm attempting to do things that I shouldn't do. And Val's telling me, Frank, no. And I only felt I was doing this because I didn't want her having to do it for me, even though it was best for me. But that mentality, I got this. I can go out to the store, even though I didn't had hernia surgery or whatever the case, and I'm good.
Actually, I wasn't. Ain't supposed to be driving, right? Yeah.
So you got to get past that as a man. You got to get past that stubbornness and listen.
And listen. I'm glad you said that. So when did you start listening?
I'm getting better.
He's getting better. He is getting better. So I want to ask you guys, what advice, suggestions, or information would you share to those who are going through the same or similar circumstance?
I would say that, as me and Rachel said, first, I think you have to have a strong relationship with God to go through it. Take it to the Lord in prayer and be sincere,
Mm-hmm.
and be sincere with everything. Be sincere with your wife. Don't try to hide it. If you feel it, whatever it is, just be honest and don't try to hide things. And she can help you. Your mate can help you better if you just honest. If you just be real, and then we can. If you try to hide stuff or you try to cover up stuff, they can't help you. So I would just say be real with it, be real with God with it, and like you say, when those rough days come and the person is ornery or whatever, let them have their space. Say, go ahead. When you finish that, I'll be back. You don't have to wallow in it with them. I'll be back because I ain't coming to your little party. But when your party's over, I'll come in the room with you. But you have to have little things, tricks you have to do for your own sanity, lest you go crazy. You know what I'm saying?
Yeah.
I don't like about that urinal thing, okay?
You're gonna have an offline conversation about that.
Offline conversation.
Well, I would say if you're going through something, you really have to be patient with the one that's sick.
Yeah.
Be patient because you don't get sick right away. You don't get over things right away, so it takes time. So be patient with the person as they're going through the different stages. Read whatever information you can about the illness they're going through, so you will know how to help them.
That's what Rachel really helped me. Rachel read everything.
They give them information about, the prostate biopsy, the this, the that.
Throw those papers
and he throw them to the side. So I'd read them and I would be able to tell them, look, Danny, you have to go for this, do that.
Rachel helped me out.
He didn't read anything.
I really have to say, Rachel helped me out a lot. Reading the Walgreens, just reading the Walgreens, what could happen to you with this
side effects and all that, certain things,
and just reading the procedure. I mean, because I would throw it in throw it up on, but she takes it and. Dan, do you know this? And then interaction, other medicine that will interact with that medicine.
Yes.
So, these are things that Rachel, I was really blessed to have an RN to go through this because, how y'all read everything. You used to read labels. You used to, preventative maintenance and all of that kind of stuff. It really helped me out. So I was pretty blessed in that sense to have, and Frank is too. I'm sure you feel blessed too. Your personal RN.
Exactly.
Everybody should have one.
But we know they will say sometimes that's good, sometimes that's bad, right?
Exactly. Yeah. Sometimes it's good and sometimes it's bad. But that's really good, Ray. About reading everything and staying informed. Right. Read everything. Not Google. Don't go to Dr. Google because Dr. Google can drive you crazy. Right. But go to legitimate sources, real resources to get the necessary information to help you navigate through whatever illness you're dealing with. Read labels, read in terms of the medication, potential side effects like Danny mentioned, and interaction. Because a lot of times doctors prescribe medications without realizing one may have a negative impact on the other.
Right. And especially when you're going to different doctors. You're going to, urologists, the oncologists.
Yeah.
All these different doctors. And, they have to pull all that information together.
Put it all together.
And you have to give a good history and tell them, look, I'm on this. I was on this, like Danny was on several antibiotics. Yeah. And he had side effects from one of them.
Wow.
One of them, he wasn't able to walk. That's when I had to wheel him.
Wow.
He was on an antibiotic and it caused him to have like a tendonitis. Not tendonitis, but what was it? What do you call that? Meniscus tear. I think that's what they thought he had.
Yeah.
But when they took him off the medication, he could walk again. So
wow.
I don't know if it was really a meniscus tear. If now that they took him off the medication, he can walk. But I had to wheel him, and we didn't talk about my health problems, but I had open heart surgery twice. I have a heart problem. Trying to wheel a big man like this was a strain on my heart, you know?
Yeah.
So it was some difficult times that we were going through. And I mean, Danny could not walk. I mean, he was crawling. It was sad. It really was.
Well, praise God, he's walking now.
Thank
God. I can only imagine the physical toll that it took on you, Ray. And God had to cover you in order to be able to help your husband, because like you said, you have your own heart health issues yourself. So praise God, you were able to do that.
Yes, God made me stay well long enough to take care of him.
Absolutely. So my niece Cherie said that I'm her personal RN too. She said she used to call me. I used to call my auntie all the time with all kinds of questions when she was pregnant with her son, and she did. Matter of fact, when they were kids, they used to call me. Her and her sister one time were in the kitchen cooking, and Ruth said something to them, and they said, "Okay, well, I'm going to call on Val." I don't know what happened, but they were, I think, 5 and 6. And they said, "Call on Val."
Right.
Yeah, but and something else you guys mentioned earlier about early detection. And I encourage men, I encourage you, stay on top of this. Go get a blood test. If you don't want to get the prostate exam, because I know a lot of men cringe at the thought of getting a prostate exam. Go get the blood work. If you don't want to get the prostate exam, just get the blood drawn. That is a good place to start. Even if it is falsely elevated, there could be some investigation done and you can come to that conclusion. But suppose it's not falsely elevated, suppose it's real.
Right.
And this early detection is so easy. So go and get that blood work. You go to the gym, you lift weights, you got muscles, you might run, you might be an athlete, you might do all those things. But what about the rest of your body? Take care of that as well. Be proactive. So I want to thank you guys. I appreciate you, Frank, and I appreciate you guys so much for being here and for sharing.
Yeah, Danny, Rachel, yeah.
So you guys know I love you all, and I'll be seeing you soon, hopefully.
Okay.
All right. Thanks again. Love you.
I had a great time with you guys.
Yes.
All right. See
I appreciate that. So I'm going to take you guys off the screen. And I just want to say to anyone who's still here, again, this is Marriage Matters brought to you by Marriage Beyond the Breach. And again, like, share, subscribe. MarriageBeyondTheBreach.com is our website. And we are here to help you navigate when there are challenges or complexities that you may face in your marriage, or even if you have a good marriage and you want a great marriage, reach out to Marriage Beyond the Breach, and we will be there to assist you. God bless. Bye-bye.